Hello. Hi, my name is Nourbese Flint, and I am super excited to be here with you all today virtually, and hopefully in a few be able to join you in conversation around the policy pieces, which is my jam. Um, I'm going to do a quick conversation with you all on Black women's health, which is one of my favorite topics. So this is talking to the T on Black women's health in Los Angeles County. So, for those of you who are not actually familiar with Black Women for Wellness, I wanted to spend a moment about who we are and who I am. Black Women for Wellness started in 1997. Are based in Los Angeles, South Los Angeles, and also have an office in Stockton, California. We are a reproductive justice organization committed to the well-being Black women and girls. We also have a C4 that started in 2017. For those of you all who are not familiar between what's a C3 and what's a C4. A C4 really is our political action space and where we do our political work at. Um, so today I wanted to spend a conversation giving a snapshot about Black women in Los Angeles. But first, I wanted to talk a little bit about reproductive justice because I do think that it's important for us to have a shared understanding of how we approach, and when I say we, Black Women for Wellness approaches our work, and we do that through an RJ lens. I'm going to give a couple of snapshots of national polling that we did. It was done in 2018, so this was pre-COVID. And there's, I would say, some high-level policy solutions. I don't even say that, but some conversation starters that we can have when we get to the conversation and together about how do we address some of these issues that are brought up in the snapshot of Black women in Los Angeles. I do want to say, though, we can spend a full conference talking about all the things that are impacting Black women's health in Los Angeles. And so I'm going to give some high level pieces, but know that there are a ton of things that I have left out when it comes to our health. That I'll be happy to talk about in later times, but want to respect the time and y'all's time today. So let's get into reproductive justice. So reproductive justice is a framework that was created by Black women for women of color in the movement. It comes from a human rights framework that looks at oppression. And so this definition comes from In Our Own Voice, National Black Women's Reproductive Justice Agenda, which is our national partner. And it's defined here as means the human right to control our sexuality, our gender, our work, and our reproduction. That right can only be achieved when all people have the complete economic, social, and political power and resources to make healthy decisions about our bodies, our families, and our communities in all areas of our lives. And so I think what is really important about this is that reproductive justice uses a lens of how do we dismantle oppression. It is not a conversation about making people more resilient, making Black women more resilient, to be tougher, to stand up to the issues of racism and oppression and misogyny, but actually how do we work to dismantle those pieces? So what does that mean in practice? I mean, a lot of us have seen the conversation and the difference, right, in our public health schools on the difference between equality and equity, right? But BWW and the RJ movement looks at what is us to look at liberation, a liberation framework, which was, again, dismantling barriers, right, for people who can live lives that are joyous and thriving. And I know the conversation of the day, and a lot of people have been talking about equity this, equity that. I'm not saying there's a problem with it. It's definitely a step in the right direction. But again, when we're thinking about the hat that BWW uses, we are thinking about a liberatory type of framework when we are addressing policies and issues that are impacting Black women. So before we get into the snapshot, I did want to take a moment about the overlying issues because, like, when people talk about what is impacting Black women, sometimes we skip over this part, right? We don't talk about white supremacy and racism and colonialism, and particularly patriarchy and misogyny. But I just wanted to lay that out there so that it's very clear that these are the overarching structures that we are impacting our health and that we are working to dismantle. And I say this because our work, our policy work, our culture work, our advocacy work, everything that BWW is thinking about is coming with this framework of how do we dismantle these structures that are impacting our lives. And that is a unique framework. It's not unique to Black Women for Wellness, but it's a unique framework in addressing policy, right? Because we are looking at both upstream and downstream issues that are impacting Black women and asking ourselves the question with every piece of policy, are we getting closer to dismantling these structures that are killing us in every way possible? So, snapshot of Black women in Los Angeles. I think it's important for us to understand and remember how many Black women are here. So Black women make up about 9.4% of Los Angeles County. That is not a huge percentage, but it's a large number. Just for reference, California has about 6.5 or so Black folks or we make up about 6.5% of the population overall. But that is essentially about the fifth largest population of Black people in the country. And so when we think about that and think about the numbers in Los Angeles, even though we are a small percentage, we are a large number of folks, right? But that percentage, I think, is important when we start looking at some of the health disparities. And then just in terms of age breakdown, Black women are pretty much in the middle. We're running a little bit older than Latinas, but a little bit younger than white women in terms of our age breakdown. And this is of the adult population. So I want to start a little bit off with economics because this is, again, completely linked to our ability to live and thrive and our health. And the first thing I wanted to raise up is the amount of single Black women who spend more than 30% of their gross income on rent, which is 72.4%, which is an astronomical number. But if you look at the number, particularly when you think single Black women with children, not only it's a huge amount, but I believe the average is about 70% of their income is spent on rent. And so when you look that Black women are not only just cost burden, but hugely burdened, right? Spending upwards of 50 and 60% of their take home on rent, it does not leave a lot of space for the other parts of paying for life, as well as being able to have upward mobility, savings, buying a home, and all those other pieces. So Black women, a tendency, like a lot of folks, are one paycheck away from homelessness, one paycheck away from a disaster that can happen and kind of destroy our ability to move. The other piece that I wanted to make sure to highlight is that Black women compose the majority of the homeless women in Los Angeles County. And these are all Los Angeles County numbers. And so when we go back and think about, we are only 9% of the population, but we make up 40% of the homeless population. And some people think that it's more. That is definitely putting the spidey senses of that we are over-indexed by quite a bit in the homeless population, with the largest growing homeless population is older Black women, right? And this also links to this piece of Black women between the ages of 16 and 64 have really high unemployment rates. And this is all, again, pre-COVID. We know those rates have gotten worse since COVID. There was a national report that came out looking at Black women's jobs, and that we were the most likely to have lost our job during COVID. So what does that have to do with our health? So the first thing is that in Los Angeles County, Black women are the least likely to make it past 85. I think that is important for a couple of reasons, because our life expectancy is going down. But also, what does that mean that we lose our elders in our communities, both with the knowledge and just having people who can babysit and all those other pieces, right? We also are really over index when it comes to risk factors for heart disease. And I wanted to take a pause there when I talk about heart disease, because a lot of times people immediately think about, oh, well, maybe Black women need to walk more, some other pieces. And for Black women, heart disease is very much linked to stress. So the stress of our lives, the stress of racism, the stress of intimate partner violence, the stress of jobs, is literally breaking our hearts and killing us in ways that are astronomical. And so the way heart disease manifests in Black women are very different than other populations. And I wanted just to plug that there. The other things that I think is super important for us to note, that like Black women have rates of depression that are growing, that we also have high rates of asthma. And then also with the breast cancer rate, we are the second highest rate of the second highest rate of folks to get to breast cancer, right? White women beat us in that space. But we are more likely to die from breast cancer, which I think is an important point for us to also think about, and those intersections between housing, economics, education, access, and healthcare, right? Because all converge into our ability to live. So one of the things that we spend a lot of time working on at Black Women for Wellness is maternal and infant health. Maternal and infant health are indicators of lifetimes worth of issues that can happen, or lifetime worth of thriving and joy, right? And maternal death rate of Los Angeles County, this was from 2018 report, is 85.8 per 100,000 live births, which is astronomical, and about 3 to 4 times higher than anybody else in the average of Los Angeles County. The California average here is 7.4, might be 7.6 at this point, but it's really hard to get California numbers. They haven't been reported in a couple of years. And so it's not exactly an apples to apples conversation, because these numbers came from about 2013 to 2015, and the maternal death rates of Los Angeles County are a little bit later. They're again about 2018 numbers. But then also looking at and thinking about that with infant death or rates, Black babies are twice as more likely to die. I think that's also important when we think about the very low birth weights, the premature birth weights, or premature birth that is happening. They're all contributing to infant death rates. Again, I wanted to take a moment to talk about chlamydia and syphilis and STDs in general. One, because that's a thing that seems to be taboo in conversations in Black communities, but then the conversation very quickly turns to the habits or what's going on with Black girls, as is the conversation, or Black teenagers, that this is like, oh, maybe they're promiscuous. And I wanted to reframe that conversation about STDs and really have us think about particularly that these are almost canaries in the coal mine, right? Because STDs and STD rates are directly linked to the socioeconomic status and upward mobility, right? So if people are in spaces that they don't have a lot of different partners to choose from, if they are in spaces where education is not free and available, or good education, quality education, that they're not able to get the access to healthcare that they need, that they don't have access to jobs, then you see also STD rates go up. And so when we see STDAH rising like they are and have been in the Black community in a while in Los Angeles and California as a whole, I think this is also an indicator of us thinking about how are we having and looking at opportunities for our young people and their ability to live and thrive as well. The last piece I wanted to really talk about when it comes to health is intimate partner violence and violence in itself. And this is because of how prevalent it is in the Black women community. Black women make up 25.4% of women who reported IPV. Again, that's the highest number out of everyone. We are twice than likely to visit emergency rooms, 4 times as likely to be hospitalized from IPV, intimate partner violence, and also has the highest rate of homicide. So when we think about both our economic opportunity, when we think about our health care, our access to health, when we think about our homelessness, this is also directly linked to, are we in safe spaces for us to make decisions that are autonomous, right? Are Black women being put in situations that are more likely to experience IPV because of all the other social economic factors, and again, racism and misogyny that are impacting us, that limits our ability to actually be safe and autonomous in our work. So with that, I wanted to share a little bit from this polling. This is national, so all the other numbers were from Los Angeles County, but I did wanted to share this piece, and especially picking it back over IPV. Excuse me. And one of the things that I thought was interesting here was over 1 out of 4 Black women have been raped in their lives. And when we looked at Black moms in particular, I didn't have this number here, that number went up to 1 out of 3. And so again, when we think about assault, control, safety over our bodies, there needs to be a lot of deeper conversations happening within Black community, a lot of deeper conversations happening around toxic masculinity, right? That is literally, again, killing Black women. And also because of all the other factors of our access to wealth, our access to be able to pay for our homes and foods and not live in poverty, has everything to do with our access or our lack of access to feeling safe in our own homes, and putting in spaces again that we are feeling pressure. The other piece I wanted to rise up, and which is again in a part of this polling as well, was how people are thinking about having children. And a lot of folks, and this is Black adults, not Black women in this conversation, are thinking about their access to living wages, the amount of money and education, right? And so those things are high on people's priority lists. And people are making decisions about whether or not they're having children based on these issues. The last piece I wanted to talk about is this one polling piece around water. And I think this is particularly important because I did spend a lot of time talking about environmental justice and environmental health in particular, which is one big piece of Black Women for Wellness work. We know that global warming and climate change are particularly impactful in terms of birthing outcomes. The hotter it gets, the more likely you are are more likely or linked to stillbirths, our premature birth, and our very low birth weights. You the more access or more carbon that you have in your community, the more likely you're going to experience asthma. Um, we know that the environmental toxins, both from fracking and oil oxidation, are linked to cancer and the chemicals that they use. And particularly, I think it's important. I'm thinking about the products, from our hair care products to our personal care products, that have a direct impact on both our fertility, but also rates of cancer and all those other pieces, because of endocrine disrupting chemicals and other toxic chemicals that are put in those products, right? So that's some other pieces that we should also be thinking about when we're having these policy conversations. Here, I wanted to push out or think about how many people, or Black adults in particular, just didn't have good water. Which, we had this conversation and we looked at Flint um, and a couple of other places, but it seems that is a national issue going on in Black households of not having clean water that is coming out of the tap. And how, again, that's another space where people are thinking about how to raise their families and getting chronic conditions because they don't have access to clean water in our parks and other pieces. So, what do we do? I went over a whole ton of issues that Black Women for Wellness has policy pieces on almost all of them. I will share a little bit about our agenda, or make sure that I send that to you all. So I won't spend a whole lot of time going through those pieces right now. But I will say that the pieces that we definitely want to raise up is addressing racism, not only in care, but structural racism, because again, those pieces are killing us. Also looking at expanding access to quality, affordable healthcare, universal child care, right? Thinking about how we are implementing and thinking about the gender wage gap, because it has so many other implications on our health and well-being, whether it's food access, whether it's intimate partner violence, whether it's maternal health, right? We also are thinking about how climate change, climate crisis, global warming is impacting our health. Urban deserts are impacting our health. Even the lack of having parks has been impacting our health, and how we can address those. And then creatively thinking about addressing the housing crisis. And when I say creatively, a lot of conversations about housing is about building more affordable housing, but I do think that we need to be thoughtful about how we take space in housing as well. And are we thinking about how we're like matching maybe grannies up with young moms, or thinking about how cohabitations and ways that we haven't thought about before as a way to address some of the housing issues, as well as building and thinking about more affordable housing pieces. So I will say that we're working right now on a national blueprint. When it's finished, I'll be happy to share those pieces with you all. One of the things I didn't get to talk about, which is one of my favorite subjects, is issues around the genetic engineering and health, assisted reproductive technologies as well. And so those pieces are in that. As well as some policy solutions from maternal to abortion access to chronic health disease. And then again, Black Women for Wellness is going to be updating our agenda for California, and be happy to share that when we're looking at policy solutions. But I do wanted to give a couple of things for food for thought for the conversation that we're going to have together. Lastly, I did want to raise up that policy work is super important. I'm a policy person. I love it. It's my jam, like I said before, but it's also not the only work, right? And so any policy, any good policy, we need to think about implementation and follow-up. We need to be thinking about how bold and innovative we are and how it's working to dismantle oppression. We also need to be thinking about how it gets impact us now, but the issues that might be coming up later. Again, one of the pieces that we work on is genetic engineering. It seems like that is 20, 30 years down the line. Is absolutely is not. And so how we also thinking about how technology is moving, particularly around health and biotech, and that impact on our communities and what that looks like, both in the experimentation of it, right? But also in the, excuse me, in the application of it. Like, do we get to benefit from the technology as well, or in the same ways? Also, when we think about policy, we have a tendency of thinking about governmental policy, but there's also internal policies and regulations and corporate policies that we could be working on as well, as we push the conversation forward. And again, accountability, right? And we can dream up the greatest policies in the world, but if we don't have great folks to implement those on the other side, then they're kind of just sitting there, on the books, which again, we want to make sure that we are building a base of folks that are thinking about how and who is representing us, and asking those questions to those folks. And then lastly, just using arts and media to shift culture work. Policy work is much easier when we shift the culture towards the work that we want to see in the world that we want to see. And so that we cannot leave that out of the discussion when we're thinking about policy, even if it's as simple as doing the political education for people to understand why we need those pieces. So with that, I will end, I will cede my time and look forward to having this conversation with you all today. Thank you.